and we're willing to help support you. Pimentos has been serving free food, so let's give it up for Pimentos. Jared is making, I make it feel some kind of way.
We see ourselves in the communities that we are serving, and we want to make sure that we are a part of the community as well as serving the community. So we do a lot of work outside of our day-to-day jobs, coming into the community, asking for their needs, and then making sure that those needs are met.
And we know that 80% of what happens to our health happens outside of the healthcare system. It happens outside of the clinic, outside of the hospital. So we're meeting our community where they're at. And that has been amazing. We're teaching them about their numbers, why their diabetes, why checking their blood sugars matters, why checking their blood pressures matters, and all of that stuff, and preventing quick problems from issues that they could have in the emergency room. We're helping with that.
Sometimes I think when we live in suburbia or we live in little cities, we don't see this type of movement. We don't see this type of community. And my kids and my family needs to see that in order for them to feel like they belong. And they're here really excited. They're here going up to everybody and feeling like, oh, this is my family and this is my uncle. I think they see themselves in all of the booths and all of the singers. And, just the drummers being out here, my daughters were dancing like there was no tomorrow. And now I think I have dancers on my roster that I have to figure out how to help them become that.
As the third annual George Floyd Rise and Remember event culminates, this great group of nurses marching on what you could call a melodic medical mission, working so that health outcomes rise here in this community, while at the same time making sure we remember to honor George Floyd, as well as the spirit and the meaning of this landmark event.
I am hopeful. I can see a lot more. We're paying attention. We are keeping track of the data. We are holding people accountable. I can tell that especially for the clinics and the hospitals I've worked with, I can see that they're interested, they care about our community, and that gives me a lot of hope.
We are experts in healthcare, and that's where we need to focus on, and making sure that the healthcare we provide inside the hospital is what people are getting outside of the hospital. And the people that they're meeting with are treating them with the same dignity and respect. I think that's what Rise and Remember for me has alluded to.